a vote buying mechanism when Medicaid's getting cut than what was put in on the rural hospitals. One of the things we could do, Mr. Secretary, is make sure that the folks who work in rural hospitals get an 80% reimbursement of what folks get in more urban centers. Would you support that legislation?
Are you talking about the area wage index?
I'm talking about the area wage index and moving that up to 80%. So there is actually ability to get rural providers.
President Trump supports that, and we support.
You support. You support. Good. So you will work with us to get that passed.
Yes.
That will increase costs on both Medicaid and Medicare. So you are committed to that. I appreciate that. What about Senator Wyden and I've got a bill because across America.
What about what?
Hospitals are shutting down on their OBGYN services. Try to have a baby. I don't know about all of my other friend states, but in Southside Virginia, you can't find a hospital. Will you work with us to make sure that before OBGYN services are taken out of a rural hospital, there has to be a process and procedure?
I'm happy to work with you on that, Senator, meet with you and see if we can work with you on it. I don't know exactly what the issue is.
Well, again, the Secretary of Health and Human Services, who has said he doesn't know how many people died from COVID, doesn't know if the vaccine saved lives, doesn't understand the issue that OBGYN doctors are fleeing rural America because they can't afford it. And with the cuts that are coming up, it's going to be exponentially worse. I would invite you, sir, to come with me to a community health center in Virginia and hear what is on people's mind. They want to get healthier? Absolutely. Count me in. But they also don't want their basic health care removed. Thank you, Mr. Chairman.
Senator Langford.
Mr. Chairman, thank you. Secretary, good to see you again. As I traveled around Oklahoma during August, it was great to be able to be home. I had several folks that contacted me. We had some great meetings with some rural hospitals as well. They're looking forward to the $50 billion for the One Big Beautiful Bill that is targeting towards rural hospitals, starting with $10 billion next year. I know you're quickly getting all the instructions out on that. We know that's in process. It was good to be able to visit with them and be able to talk about that. They're very pleased. Thanks for the work you're doing on that. I also met with some of our groups that do incredible medical research on this. I know the NIH grants were held for a while and being studied. Those have been released. And grateful to be able to see that because there's some amazing medical research is happening, including some longitudinal studies. They need those dollars released, so I appreciate y'all getting those released out there. I did hear from a lot of our folks, and I want to talk about one of these issues. From a lot of our hospitals, they immediately raised the issue of Medicare Advantage plans and how they're withholding payments, they're delaying payments back to hospitals, and a problem that's been for rural hospitals. I know y'all are working on that as well. We want to work with you on that. But you and I have spoken on the second issue on that, and it's the pharmacy benefit managers. During the confirmation process, it was interesting when you and I met in my office, you said every single senator brought up PBMs to you, and you made the statement during the confirmation process, this is an area that President Trump wants to take on, is the pharmacy benefit managers. This is unfinished business in this committee. But I wanted to just know, what is HHS doing at this point on the PBM issue in particular to make sure we're not driving out rural pharmacies, and what we can do to be able to make sure that's fair?
I mean, it's a priority for the president. He talks to me about it, I would say, at least once a week, sometimes at 11 o'clock at night. And we've met with the PBMs, and we are in talks with them. We're also in MFN talks with the pharmaceutical companies, who are also very interested in reducing the cut and getting transparency among the PBMs. And the PBMs have committed to us to transparency, to some protocol that will guarantee transparency. And then the part of the MFN negotiations would include direct-to-consumer marketing, which would eliminate the middleman. So I think we're doing a lot on PBMs.
Okay, that'd be very helpful to be able to see. It'd be very helpful for consumers across the country on this. You and I spoke as well, and you've made public statements on this, and the FDA commissioners made public statements on the issue of reviewing the safety issues of mifepristone. Your comments early on were every drug needs to be treated the same, needs to look at the same, and not have political biases and how things are actually examined. There were a lot of changes on the allocation of mifepristone for elective abortions under the Biden administration. It's now open to anyone without a prescription on it. You don't have to go through a doctor on it. There's all kinds of issues that are happening now on it. So the question was, you said that there would be a review on that just to be able to look at it, make sure we're following all safety protocols. Do you know a timing on that review?
I can't give you the exact timing. I talked to Marty McCary about it yesterday, and he said it is progressing apace. We're getting data in all the time, new data that we're reviewing. And we know that during the Biden administration, they actually twisted the data to bury one of the safety signals with a very high safety signal, around 11%. So we're going to make sure that that doesn't happen anymore. We're producing honest science and gold standard science on that. And I'll keep you abreast of where we are.
Thank you. Just go where the science leads on that. During the Biden administration, the Title X regulation that requires Title X family planning programs recipients to physically and financially separate from abortion activities, their Title X activities, and eliminate them promoting or providing abortion with those funds. That was flipped from the original Trump rule that was done on the first presidency. During your confirmation, you had committed to go back and look at that again and to be able to see. My question is, do you know the timeline for agency action for when that rule on Title X and the separation payments rule will be either reviewed or will actually be reinstated to the original Trump rule under his first presidency?
I don't know if they're I just don't know the answer to your question, why they're actually reviewing the rule right now. I can tell you that the NGOs that have that issue, that refuse to separate their payments streams and separate their operations, are not getting funded.
Okay, well, that was an issue under the law when it first came out, to be able to keep those things separate on it. So yeah. Look forward to that. Thank you, Mr. Chairman.
Thank you. Senator Hassan.
Oh, thank you, Mr. Chairman, and good morning, Secretary Kennedy. Just before I ask a question, I did want to note, in response to the Secretary's statement that the Trump administration wants to lower the cost of health insurance, that across the country right now, the median increase from commercial insurers that we're seeing this fall is 18%, just as families are struggling to make ends meet. Now, I want to follow up on a line of questioning that Senator Cassidy began. Mr. Secretary, President Trump said that the COVID-19 vaccine produced by Operation Warp Speed was, and these are the president's words, a monumental national achievement. Although I've strongly opposed many of President Trump's actions, I agree with him that Operation Warp Speed in 2020 was a monumental achievement. Unfortunately, you are undermining one of the president's biggest achievements, which, as the president said, saved millions of American lives. You even went as far as to call President Trump weak for this life-saving accomplishment. Last year, you tweeted that President Trump has a weakness for swamp creatures, and that Operation Warp Speed was among, here's your quote again, the most devastating impact of President Trump's weakness. So, Mr. Secretary, was Operation Warp Speed a monumental national achievement, as President Trump said?
For the reason that I already said, and I assume you won't let me repeat, but I'm happy to if you want, yes, it was.
Good. Assuming it is a monumental achievement, you've said it was, is it true that, as President Trump has said, he saved millions of American lives with the COVID-19 vaccine? Because you've just expressed great confusion about that to Senator Warner.
The only confusion I expressed is exactly how many lives were saved. I don't think anybody knows that because of the data chaos.
So multiple studies have shown that the vaccine reduced infections and severe diseases and saved at least 3 million lives in the United States and millions more abroad in the first 2 years of the pandemic.
It's possible those are modeling studies.
I will also note, just as you've been talking about data and concern about it, the process for COVID vaccine approval was public, it was live streamed, and it was out in the open. Manufacturers and experts have publicly submitted data analysis, and when the FDA has asked for more, they've submitted more. They've done that for years, and the evidence is clear and supports what President Trump has said. The vaccine works, and it has saved millions of lives. Your own process, on the other hand, has not been transparent. You repeatedly choose to ignore data because it doesn't match your preconceived notions and lies. So you have said that the vaccine did save lives. You've said it was a monumental achievement. And given that, if you agree with President Trump that the vaccine saved millions of lives, why have you acted behind closed doors to overrule scientists and limit the freedom of parents to choose the COVID vaccine for their children? Why have you done that?
For the COVID vaccine, I was removed by FDA because there was the industry.
No, it was behind closed doors.
No, it's not Paul.
And scientists who said they wanted to brief you on the science, scientists who wanted to understand why the FDA, why you unilaterally changed the parameters for giving vaccines, making it possible now, to Senator Cassidy's colleagues' points, that they're going to have to go off-label
This is crazy talk. You're just making stuff up.
to prescribe a vaccine for children. I'm not making things up. Do you know how the FDA approval process works and what happens?
I know exactly.
Do you know what an off-label prescription is?
I know exactly how it works. I know exactly how it works.
So why behind closed doors?
It's not behind closed doors. The industry makes the studies, and they could not provide a study that said that it is effective for healthy kids.
So when have you produced the data that you relied on and that this FDA relied on to change those parameters? You did it behind closed doors.
No, the data is all public.
Now parents who decide that they do want their children to have
You're just
COVID
making
vaccine
stuff up, Senator.
I'm not
You're
making
just
stuff
making stuff up.
You know, sometimes when you make an accusation, it's kind of a confession, Mr. Kennedy. So let's just settle with this. So here's what's going to happen. To Senator Warner's point, to the parents who are concerned all around the country, to people who want to get the COVID vaccine this fall, even if they're under 65, because the boosters have worked, there's been much less serious disease, people do not have the same level of threat and risk from COVID that they used to because of these vaccines. People who want to exercise their freedom of choice are being denied that.
Everybody can get the vaccine.
Because you are citing data that you won't produce to the public.
You're just
and you are rejecting
You're
science.
making things up to scare people, and it's a lie.
With respect, I do not think I'm the one making things.
You are
Thank you,
lying
Mr. Chair.
right now, Senator.
Senator Barrasso.
Thanks, Mr. Chairman. Mr. Secretary, thanks for being with us today. I believe one of President Trump's greatest achievements was his bold and successful actions on COVID. When faced with a global pandemic, he didn't back down. He was determined to find a cure, and through Operation Warp Speed, a vaccine was developed that distributed quickly, safely, effectively, and I believe it saved many, many lives. I think it's a model of American ingenuity and public-private partnership. But this wasn't the first time an American president acted boldly to address disease and vaccines. There's a great book that's out. It's a prize-winning book called The Fate of the Day by Rick Atkinson, and he talks about the courageous efforts by George Washington. During the Revolutionary War, George Washington reversed his opposition to the smallpox vaccine, and he ordered that all the soldiers be vaccinated. It was among the most consequential decisions Washington would ever make. By protecting his troops from smallpox, Washington preserved the Continental Army, which allowed our nation to continue to fight for our independence. And like President Trump, I believe President Washington acted decisively to protect Americans' lives at a time of great national peril. So over the last 50 years, vaccines are estimated to have saved 154 million lives worldwide. I support vaccines. I'm a doctor. Vaccines work. Secretary Kennedy, in your confirmation hearings, you promised to uphold the highest standards for vaccines. Since then, I've grown deeply concerned. The public has seen measles outbreaks, leadership of the National Institute of Health questioning the use of mRNA vaccines, the recently confirmed director of Centers for Disease Control and Prevention fired. Americans don't know who to rely on. You know, recent polls said 89% of voters, 81% of Trump voters agree vaccine recommendations should come from trained physicians, scientists, public health experts. So, you know, they believe, you know, Senator Marshall, Senator Cassidy, they believe me when it comes to vaccines. If we're going to make America healthy again, we can't allow public health to be undermined. So could you explain what steps you're going to be taking to ensure vaccine guidance is clear, evidence-based, and trustworthy?
Yeah, we're going to make it clear, evidence-based, and trustworthy for the first time in history. For most, right now, you know, when I was a kid, I got 3 vaccines, I was fully compliant. Today's children have to get between 69 and 92 vaccines in order to be fully compliant, between maternity and 18 years. Only one of those 19 vaccines, 92 doses, only one of those vaccines has ever been tested against an inert placebo. And what we're doing now is any new vaccine that before it's approved and licensed will have to demonstrate safety against an inert placebo. And we're going to go back and do observational studies on the existing vaccines to see if they're linked to any of these chronic disease epidemics so that people can understand the risk profile of those products and make good assessments for their own health.
So in 2 weeks, vaccine experts at the CDC are going to meet to discuss childhood vaccine recommendations. Parents and physicians depend upon this guidance to make decisions and to keep kids safe. And as I said, I support vaccines. I've been hearing from many of my medical colleagues, people I've known from medical school, residency, and when I practiced medicine in Wyoming, and there are real concerns that safe, proven vaccines like measles, like hepatitis B and others could be in jeopardy. And that would put Americans at risk and reverse decades of progress. As we've seen over the last 4 years, the previous administration 4 years, when recommendations became politicized or were swayed by bias, that the public trust can be lost. So what safeguards are in place to ensure decisions are based solely on science and not politics? And how are you going to make sure doctors and parents can count on CDC guidance?
I mean, Senator, I would point this out. Right now, there's only 10% of children are complying with the CDC's recommendation on COVID boosters. Only 15% of healthcare workers. So Americans have lost faith in CDC, and we need to restore that faith. And we're going to do that by telling the truth and not through propaganda, by making them understand that everything that we say is true, that we're going to tell them what we know, we're going to tell them what we don't know, and we're going to tell them what we're researching and how we're doing it. We're going to be transparent. It's the only way to restore trust in the agency, by making it trustworthy.
Finally, with chronic diseases like you, I'm committed to addressing our nation's growing rate of chronic diseases. I think if we're going to make America healthy again, we need to support rural primary care providers that play a role. As a rural physician, I want to make sure we can prevent and manage chronic diseases in their communities, and I ask for you to continue to work with us specifically with regard to rural health.
Thank you, Congressman.
Senator Daines.
Chairman Crapo, thank you. Secretary Kennedy, welcome. It's good to see you here again. I want to begin my time by talking about the issue of federal deregulation of chemical abortion drugs. Since mifepristone was approved in 2000, 25 years ago, the FDA has steadily stripped away safeguards related to this drug, no longer requiring a doctor's prescription, no follow-up visits, no adverse event reporting, and now allowing it to be sent through the mail. Earlier this year, there was a new study that analyzed 865,000 real-world insurance claims, and it found that nearly 11% of women experienced a serious adverse event within 45 days of taking mifepristone. To put that in perspective, that is 22 times higher than the FDA's long-standing estimate of less than 0.5%. While these findings alone are shocking, my conversations with those in the medical profession, credible medical professionals, lead me to believe that even this study may indeed underrepresent the scale of the problem. For years, we've heard the misleading and frankly very harmful lie that's being sold to women that this drug is, and I quote, safe as Tylenol. These lies sadly have real-world consequences. Just last year, 2 women died as a result of taking chemical abortion pills because they were able to access them without appropriate medical oversight. And by the way, that's all allowed by the FDA. Mr. Secretary, I am grateful that you and FDA Commissioner McCary have already begun the process of reviewing this new data on the safety of mifepristone. We talked about this during your confirmation hearing. My question is, could you provide any updates on the status and the scope of that review and whether the FDA intends to replicate studies like the one that I referenced?
I think those are, I don't know if they're going to do an insurance claim study. That's one way to do it. I don't know exactly whether they're doing epidemiological studies or observational studies. I don't know exactly what they're doing, but I know I talked to Marty McCary about it yesterday, and he said those studies are progressing and that they're ongoing. So I will keep your office informed at every stage.
Thank you. And I've had a really constructive conversation with the FDA Commissioner as well, McCary. And I mean, here's a very smart, data-focused, sincere type of leader. And we had a really good conversation. I want to encourage those conversations with you, Mr. Secretary, and that there's a follow-up here to make sure that the data that we now have exposed will be studied by the FDA and the appropriate actions considered. Given the legitimate safety concerns surrounding mifepristone and your actions to roll back other COVID emergency measures, will you repeal the COVID-era telemedicine allowance, given that we're repealing these COVID-era regulations and emergency measures? Would you repeal the COVID-era telemedicine allowance for chemical abortion drugs and restore the requirement for an in-person doctor visit?
Senator, I need to get back to you on that. I don't know if the White House has yet taken a position on that, but we will get back to you this week about that.
Okay, all right. Thank you. I want to close with a quick Montana question. Earlier this week, the state of Montana submitted a Medicaid demonstration waiver application to CMS to strengthen the state's Medicaid expansion program. This waiver seeks to require community engagement and enhance cost sharing for working-age, able-bodied adults enrolled in the program. I applaud our governor, Gianforte, and Director Brereton for their proactive leadership in this space. My question is, Mr. Secretary, could you commit that CMS will work quickly in its consideration of Montana's waiver application?
Absolutely. It sounds like the kind of waiver that we're looking for.
Okay, thank you, Mr. Secretary.
Thank you, Senator Johnson.
Thank you, Mr. Chairman. Secretary Kennedy, first of all, thank you for your willingness to serve and for putting up with this abuse. 5 minutes is even close to refute all the falsehoods that have been confidently spewed during this hearing. We'll talk about real data here, okay? Well, first of all, thank you for breaking the logjam of information of HHS. My committee's got now over 8 million pages of information. Just in the first tranche, by the way, what we discovered is that the CDC, somebody in the federal health agencies, this interagency communication, hid the signal. They admitted there was a signal on myocarditis, and they hid it. They didn't warn the public. They didn't warn doctors. So that's just one instance of corruption and lies told by the CDC. We've got a lot of others we'll be rolling out, okay? So we held our first hearing in permanent subcommittee investigation on that hiding of the signal myocarditis. We've heard a lot of studies, okay? As I've looked into science, it's been thoroughly corrupted. Here's data, and I'd like to enter this sheet into the record. I've been publishing this chart for, since really early 2021, when I'm on for example, talk radio shows, and they talk about this, they get deplatformed, or they were, because all the censorship in the Biden administration. Here's the facts. The VAERS system that was touted in October of 2020, this great safety surveillance system on COVID, a few months later, when they didn't like the results, they started denigrating their own system. But VAERS shows that there have been 38,742 deaths reported on VAERS worldwide associated with the COVID vaccine. 38,742. 9,252 of those deaths occurred on the day of vaccination or within 1 or 2 days. Again, I agree with you. Nobody knows how many COVID deaths were because the information was completely corrupted. Nobody knows how many lives were saved by the COVID. Again, I think most people, okay, if you're vulnerable, raise your antibodies, reverse severity, fine. There's not any good study on that. There's just information out there, just claims being made. This is hard evidence. And certainly what I've been advocating for are the injection injured, the childhood vaccine injured. We're going to be holding a hearing next Tuesday on a study done by a high integrity healthcare facility that shows, that actually looked at vaccinated versus unvaccinated, very high quality study. I'm not going to steal the thunder of Aaron Siri, who's going to be testifying on this. I think you're aware of this study that shows the vaccinated population far more prone to chronic illness than people completely unexposed to vaccines. That is just one example of how science has been corrupted by the way, the study was conducted, and when they conducted this, oh no, no matter what the results are, we're going to release this. They got the results in 2000. It is yet to be released. We're going to enter that in the record on Tuesday. Do you want to just talk about what you've witnessed in terms of the capture of the agencies that you're now in charge of, the corruption of science, which I believe you just said, that is almost your number one goal, right, is try to bring integrity and credibility back to science, which has been corrupted by the people who pay for it, by federal health agencies being captured by pharmaceutical industries, by big pharma, by big food. Just, I want to give you, I'm sorry, just the last minute to, first of all, defend yourself, but talk about the corruption of science that you're having to deal with and trying to correct.
Yeah, I mean, I'll just tell you one example, and I could sit here and give you thousands. But in 2002, CDC did an internal study of Atlanta, Fulton County, Georgia children, and looked at children who got the MMR vaccine on time and compared those to kids who got them later. So in other words, kids who got them before 36 months and kids who got them afterward. The data from that study showed that black boys who got the vaccine on time had a 260% greater chance of getting an autism diagnosis than children who waited. The chief scientist on that, Dr. William Thompson, the senior vaccine safety scientist at CDC, was ordered to come into a room with 4 other co-authors by his boss, Frank DeStefano, who's the head of the immunization safety branch, and ordered to destroy that data. And then they published it without that fact. So you know that story, I know that story, and you know of hundreds of stories like that. It happens all the time. We are being lied to by these agencies, and we're going to change that right now.
The letter I received from the Oshkosh business, they would be out of business because of the 50 employee mandate. I'm just going to be out of business. I just want to enter that in the record as well.
Without objection. The committee will take a 5-minute quick break here just to allow just a moment of reset here, and then we'll start right back up again in about 5 minutes. Thank you to everyone. Committee is returning back from recess on this. Senator Whitehouse is recognized for questions.
Thank you, Chairman. Mr. Secretary, I want to talk to you about Rhode Island. When you were last sitting there, here's what I said to you. I want to read it back to you because I want it to sink in. CMS has for years maintained a reimbursement system that the bureaucracy could never explain, never justify, that persistently pays Rhode Island providers less than neighboring Massachusetts and Connecticut providers, a difference of 23 and 26% in our regional healthcare market. Rhode Island's healthcare system is bleeding out because we aren't paid what neighboring hospitals and doctors are paid. And the one act that CMS took on this issue years ago was to make it worse. I raised that with you then. I've raised it since with Dr. Oz. I've raised it with CMMI Director Sutton. I would like to get action from CMS on that. One partial avenue of relief for Rhode Island is the AHEAD program. Rhode Island is a willing voluntary participant in the AHEAD program. Coming behind Rhode Island is Connecticut. What remains to be seen is whether the payment rates agreed to for Rhode Island will suffer the same discriminatory discount with respect to the AHEAD rates for Connecticut as Connecticut comes through. I've been able to get no assurances from CMS that they care one whit about this payment differential or that they see AHEAD as a means of resolving this injustice. Mr. Kennedy, our healthcare system is teetering as a result of this. This is not a casual matter, and I would really like to see you and Dr. Oz and Mr. Dutton put your attention onto this Rhode Island problem. There is no conceivable justification for paying a hospital in Fall River 23% more than Rhode Island Hospital when Rhode Island Hospital provides more and better services, as recognized by the Secret Service, which will take an injured president from Martha's Vineyard to the Rhode Island Hospital Trauma Center, flying right over St. Anne's Hospital in Fall River, yet Fall River gets paid more. It makes no sense, and it has to be resolved. The other problem that I mentioned to you is that I'm now in my 4th round of CMMI directors. It's bloody Groundhog Day, trying to get something done about how end-of-life patients are treated. I'm offering Rhode Island as a willing example of how we can do it better. It is idiotic and cruel to force a family to put their dying loved one through 3 days and 2 nights of a hospital before they can put them in a nursing home. It is equally ridiculous to not allow palliative and curative care to happen together. Providing home care when someone is dying, even if they can still get out of the house or into the yard, is a basic thing to ask. And to have respite care be that somebody comes to the house instead of taking a dying family member to a hospital, that's not even respite. Every single one, Mr. Kennedy, of these waivers has been granted in the past by CMMS and other circumstances. All I want is for somebody to come and work out how we do this in Rhode Island. What is our patient base that we'll do this in, how we put the waivers together. To quote your CMS director, Mr. Oz, he said, as we discussed in your office, we must re-examine how end-of-life care is addressed in this country. I'm offering Rhode Island as an example of how to make it better. I hope you will concede that right now it is not good. So
Senator,
I need you to respond to me. You guys know where to find me. I'm up in the Hart Building.
Yeah.
We've reached out, we've tried for meetings, and the progress in all 3 of those areas, fixing the payment gap, getting ahead balanced regionally, and following through on our desire to do good things, improving end-of-life care with waivers you guys have already granted, has gotten me so far no place. And forgive my impatience, a lot of it predates you. I put a hold on Biden nominees because I was getting jerked around by your bureaucracy.
I'd like it to end and get some progress.
Yeah, you know, Senator, you raised this during my confirmation hearing, and I said to you then, and you were very civil. You raised something that makes a lot of sense to the extent that we have the power to fix it at CMS. I'd like to do it. We've had the same kind of complaints from Vermont. But I said to you at that time, call me and let's come talk about this. You have my cell phone. You can call me anytime. I've never heard from you in 7 months. Call me up. I'd love to meet with you. I'll get Oz in the meeting, and what you're saying, particularly about at the end of life, it may be something we can do something about. I want to help, and let me know.
We'll try. Forgive my frustration. You've got 30,000 employees. They could have reached out to me. They know where I live.
Yes. Senator Cortez Masto.
Secretary Kennedy, thank you for being here. In May, you said, and I quote, "I stand with President Trump to say, no more middlemen, no more foreign freeloaders, no more skyrocketing drug prices. We're putting American patients first and taking on big pharma to make America healthy again." Yet your record tells a different story. In July, Republicans handed big pharma a massive win. Their big, beautiful bill that they just passed shields billion-dollar drugs like Keytruda, the world's top-selling cancer drug, from Medicare negotiation. Keytruda has been on the market since 2014. It pulled in nearly $18 billion last year in the United States alone. It costs patients up to $175,000 a year, draining Medicare of billions and forcing families into crushing debt or to forego life-saving care. And yet you support the big, beautiful bill. So despite the hype with executive orders and Washington Republicans only drug pricing law days relief for Medicare patients relying on high-cost cancer drugs, meanwhile, Democrats finally have allowed Medicare to negotiate drug prices. I will say that Keytruda, along with Opdivo and Darzalex, the three top-selling cancer drugs, were widely expected to be selected for Part B negotiation in 2026 for 2028 implementation. They are now, because of the actions of this administration, exempt from negotiation for at least several additional years, if not permanently. So my question to you, Mr. Secretary, is how do you justify claiming to take on big pharma while supporting a bill that shields drugs like Keytruda and other cancer drugs from Medicare negotiation, costing seniors and taxpayers billions, and risking the lives of cancer patients who cannot afford their necessary medication?
Yeah, Senator, I appreciate the question. The Medicare drug negotiations in the IRA were very well intentioned, but they were poorly structured. And what we found is that the negotiations that have occurred actually have ended up raising the costs for Medicare. We are right now in negotiations.
The CBO has not agreed to that. The CBO doesn't say that. It's just the opposite. So you're saying the CBO and independent agencies that validate the costs are wrong?
That is CMS data. That's
okay, so let's just focus on the cancer drugs. Why aren't we negotiating those, bringing those down for families? Why does the bill exempt those?
Is part of the MFN negotiations. I'm not sure of that provision in the bill, of the one beautiful bill, but you're not sure of the provision, the negotiation provision, and how exempted for Keytruda? Your agency is responsible for that negotiation, and you don't know about it? I know that we're negotiating in the MFN negotiations. Mr. Secretary, let me ask you another question. How much are Medicare Part D enrollees expected to pay for prescription drug coverage next year? I think that is in debate right now. Let me tell you. Are you talking about the rate? They are going to pay $15 more than last year, up to $50 a month. Now let me have a question for you on Part B. How much are Medicare Part B premiums expected to increase next year? I don't know. I talked to Dr. Oz about it yesterday. I think it's 16%. They're supposed to increase about 11.6% or $21.50 more each month. And again, last time you were before me, you couldn't answer the questions
of the very agency and the authority that you have